Hey, this is Nicole. I want to show you this really cool technology that we've got. So this is a feeding tube that's got LED lights and a camera on the end of it to assist with placement of a feeding tube. So it can be really helpful to make sure you're getting a feeding tube. Like if you want to go post-pyloric, you can tell very easily that you've got correct placement. So what I'm going to do is I'm going to simulate placement using this model, and what we're going to do is use the screen to identify different anatomic landmarks to indicate that we're in the right spot. So I might need a little assistance because I can't completely see the screen from where I'm standing. But what you're going to see is as we enter, you're going to see the vocal cords. What we're going to do is shoot for the esophagus.
You're in there.
Oh, we're in the esophagus, nice. So in the esophagus, you're gonna see some kind of a smooth muscle, and you might see even some peristalsis of the esophagus itself. We're gonna keep advancing until we get into the stomach. So we'll keep advancing. Once you get into the stomach, you'll start to see more kind of like ridges and ripples, of the stomach. And so how is our placement looking now?
So you're in the stomach.
And we're in the stomach.
Yep, you're pressed up against some tissue.
Ooh, let's hear her pressed up, so let's kind of move back. So you can kind of see those ridges that are indicative that we're in the stomach. So let's say we want to go post-pylorus. So what we'll do is we'll keep advancing until we see, basically what you see is little villi. You might see some bile and more smooth muscle. So you'll see the muscular composition of the tissue change as we get post-pylorus. I think I keep getting stuck in here, but this is kind of what happens when you use a model. Let's try this again. So I just pull back, and now I'm going to see if I can advance post-pylorus. How are we looking?
You're pressed up against tissue.
Yeah, I'm pressed up against it here. Let me try a little bit different angle. And you all know how challenging this is clinically in patients when we're trying to get tube placement. But once you get past the pylorus, you'll see more smooth muscle, little villi and some bile indicating that you've made it past that junction. If you get into the trachea, you'll kind of see those cartilage rings. And obviously, if you've got a patient who they might be coughing, and you might see things like that indicating lung placement. But this gives you a visualization using anatomical landmarks to tell if you are in the GI tract versus the lung. So pretty cool stuff. All right, just wanted to show you some new technology. Pretty cool, and check out that camera on the end of it. Pretty cool stuff, huh?